Hey everybody, welcome back to the Energy MD podcast where we help you resolve your long COVID and chronic fatigue syndrome so that you can get back to living your best life. So I'm really excited because today we're going to be talking with my friend Dr. Eric Osansky, and we're going to be talking about hyperthyroidism and how it fits in with fatigue. So let's learn a little bit about Dr. Eric. So he is a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who has over 20 years of experience in health and wellness and has been helping people with thyroid and autoimmune thyroid conditions since 2009. He is the author of the books Natural Treatment for Hyperthyroidism and Graves Disease, The Hyperthyroid Healing Diet, and Hashimoto's Triggers, and is the host of the Save My Thyroid Podcast, which is really good. I recommend you go listen to it because I've been on it. Well, I know it's also good because of other reasons. Dr. Osansky was personally diagnosed in 2008 with Graves' disease, and after seeing how well a natural treatment approach helped with his condition, he began helping others with thyroid and autoimmune thyroid conditions, including hyperthyroidism and Graves' disease, and hypothyroidism and Hashimoto's thyroiditis. Dr. Eric, thanks so much for coming on today.
Dr. Everett, and I'm excited to be here. Yeah, just really excited to chat about hyperthyroidism and Graves.
Yeah, so a lot of people, when they think about thyroid disease, they think about hypothyroidism or low thyroid, and Hashimoto's, which is the autoimmune version of that. Can you tell us what Graves is and how does it compare with hyperthyroidism if that is something different?
Yeah, great question. So Graves and Hashimoto's, what they have in common are they actually are both more immune system conditions than thyroid conditions. They're both autoimmune conditions, and not everybody with hyperthyroidism has Graves' disease, although approximately 90% of people with hyperthyroidism have Graves. Similar with Hashimoto's, about 90% of people with hypothyroidism have Hashimoto's. As far as the differences, so on a blood test, you have thyroid stimulating hormone or TSH, which is actually a pituitary hormone, and that signals to the thyroid gland to either produce more thyroid hormone or to slow down the process. So in the case of hyperthyroidism, you have too much thyroid hormone. So T3, T4 are the two main thyroid hormones. There's also T1, T2, but as of now, we can't measure them on a blood test. But T3, T4, when they're elevated, the pituitary gland will communicate to the thyroid gland, hey, we have too much thyroid hormone. Let's kind of like slow down or stop the production. And as a result, you'll see low or depressed TSH levels. And I mean, with Graves, typically TSH is undetectable. On the other hand, with hypothyroidism, you'll have elevated TSH because you have lower thyroid hormones. Sometimes the thyroid hormones are overtly low, like below the reference range. Sometimes they're subclinically low or they're within the reference range, but on the lower side. But either way, that TSH will increase. Again, sometimes TSH will be well above the reference range. Sometimes it'll be within the lab range, but not within that optimal range. So hypothyroidism, increased TSH, lower thyroid hormones, hyperthyroidism, decreased TSH, elevated thyroid hormones. And then again, with Graves and Hashimoto's, you have different autoantibodies. So with Graves' disease, you have what's called thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody. And what happens is those antibodies stimulate or attack the TSH receptors of the thyroid, and that is what causes the hyperthyroidism. With Hashimoto's, you have either thyroglobulin antibodies or thyroid peroxidase antibodies, also known as TPO antibodies, and they don't specifically damage the thyroid gland. They're more of a consequence. When the immune system damages certain parts of the thyroid gland, you'll get elevations in either thyroglobulin antibodies or TPO antibodies, or in some cases, both. And then I was going to say every now and then, but actually it's not uncommon to have people with all three antibodies. I'd say maybe like 20 to 30% of people I work with will
Mhm.
have elevated Graves and Hashimoto's antibodies.
Yeah, I think that that's a really important point because a lot of people think it's one or the other. So why does that happen sometimes?
Why does people have antibodies for both?
Correct.
Yeah, well, there is what's called the triad of autoimmunity, also known as the three-legged stool of the autoimmunity. And with this, you need three components in order for autoimmunity to develop. One is a genetic predisposition. Two is exposure to one or more environmental triggers. Typically, there's multiple triggers. And then three, an increase in intestinal permeability, which is also known as a leaky gut. And as far as like why some people develop antibodies for Graves, others antibodies for Hashimoto's, others antibodies for both, and then there are of course a whole array of other autoimmune conditions. I mean, there it does seem to come down to genetics. I mean, that's not the only reason why people develop autoimmunity in general, because again, we just spoke about the triad, but as far as why someone develops multiple sclerosis, and someone else will develop rheumatoid arthritis, someone else will develop Graves or Hashimoto's. There are certain genetic markers that seem to dictate or determine whether someone will develop or will be susceptible to developing an autoimmune condition. Just because you have the genetics, as you know, does not mean that you will develop an autoimmune condition, but there does seem to be the genetic component. But again, the good news is if you address, find, and remove those triggers, heal the gut, correct underlying imbalances like nutrient deficiencies, you can reverse autoimmunity.
Nice. Yeah, I love that. And so, what are some of these triggers?
Yeah, so there's I talk about four main categories of triggers. And so for example, one would be food, common example, gluten. Foods that have gluten can potentially directly affect the thyroid, uh, and also can affect the gut, increase permeability of the gut, which again is associated with that triad of autoimmunity. And then there's stress. So, like when I dealt with Graves, stress was definitely a big factor, and it wasn't just the emotional stressors, but I was overtraining prior to my Graves' disease diagnosis, and so the physical stressors as well could be a factor. Uh, Chemicals. So, as you know, with the toxic five, which goes not doesn't just talk about chemicals, but the heavy metals, the other chemicals like xenoestrogens, the microplastics that we're exposed to, the glyphosate. I mean, we live in a toxic world, and definitely that's I think a big reason why we have an increase in autoimmunity over the years, over the decades. And then certain infections, so viruses, bacteria, uh, parasites, potentially stealth infections like Lyme disease, Bartonella. And I mean, getting back to viruses during the pandemic, we had definitely an increase in people developing hyperthyroidism and Graves disease especially 2020, 2021. So we saw firsthand the impact of infections. And yeah, so those are like the four categories. And again, I gave some examples, but there are others like mold, mycotoxins, which would fall into that environmental toxins category. So that could be a factor. But yeah, I mean, so the thing is, there are usually multiple factors that multiple triggers that could lead to autoimmune conditions such as Graves and Hashimoto's.
Excellent. Yeah, and when I talk about the toxic five, heavy metals, chemicals, molds, infections, and nervous system dysfunction, I put stress and trauma like into nervous system dysfunction. So
Mm,
that's similar.
yeah.
And then I don't talk, I mean, I don't recommend that people consume gluten or dairy or sugar, but I don't talk about the food sensitivities as much because I believe that oftentimes those are caused by the other toxins and infections that are kind of triggering the immune system to be more reactive to the foods. That doesn't negate the fact that gluten and some of these other foods can cause autoimmunity as well. So I definitely appreciate that. And I appreciate the fact that you brought that up about COVID. That was going to be a question that I had. So let's go into kind of the mechanism of action. So there's chemicals or microplastics or molds that's in somebody's body. How does that end up becoming Graves?
Great question. Well, first of all, besides causing Graves, it's also important to mention that some of these are endocrine disrupting chemicals, so they could actually disrupt the thyroid, and so that's not causing Graves, but can cause hypothyroidism. And again, so you might do the testing like the antibodies for, let's say, Graves and Hashimoto's, and everything's negative because it might not be autoimmune. It might actually be those chemicals directly affecting the thyroid. But then also I mean, a big thing is they cause, well, a few things. So that the research does show that certain certain heavy metals like mercury, mycotoxins, microplastics do affect the permeability of the gut as well. So again, that's one way that it leads to autoimmunity, not just Graves, but other autoimmune conditions. But also, it does seem to dysregulate the immune system as well. These chemicals. I mean, it doesn't seem they definitely definitely do affect the immune system in a negative way, cause an increase in pro-inflammatory cytokines, and that inflammatory state again will make someone more susceptible to autoimmune conditions such as Graves.
Yeah, I'm glad you mentioned inflammation too, because oftentimes we think of inflammation as a bad thing, but it can be, I mean, it's supposed to be a good thing, right? Can you talk a little bit about that dichotomy?
Oh, about inflammation. Well, yeah,
Yeah.
yeah, I mean, you're right. I mean, it's not all bad. Like when you suffer an injury and you have some trauma, you definitely want some inflammation to the area. I mean, you don't want too much area inflammation. So, I mean, you might ice it and try to get that inflammation down. But again, it's an immune response, and you wouldn't want to completely suppress that immune response if you have, I mean, if you have an injury. So, yeah, I mean, inflammation gets a bad rap, but you're right. There's both good and bad. There's not only pro-inflammatory cytokines, but there are anti-inflammatory cytokines as well. And yeah, so you want really balance is the key when it comes to those cytokines. You don't want you don't want to have solely anti-inflammatory cytokines. But again, you just with autoimmunity, sometimes it does get out of hand, and so you might need to not only do things to find and remove the triggers, but do take certain supplements in addition to like eating anti-inflammatory foods. You might want to take some things like selenium. I mean, vitamin D has been proven not only to help with bone density, but also help, it has anti-inflammatory effects. Omega-3 fatty acids, usually I recommend fish oils. So if someone's deficient in those, especially, which is common, then yeah, I mean, pretty much I have most of my patients take fish oils, just because when doing like an omega-3 index, it seems like most people are deficient. And there's a time and place for other things like curcumin, proteolytic enzymes, uh, resveratrol. So again, I'm not saying I recommend all those things, but time and place for certain supplements as well.
So there's some of these toxins or infections that are in the body. They're damaging the lining of the gut, causing leaky gut. 80% of the immune system's in the gut, causes the immune system to react. How does that end up becoming Graves' disease? So it's the autoimmunity is progressing. What happens next?
With the leaky gut, well, I mean, like you said, most of the immune system cells are in the gut, and I mean, I don't know if you want me to get into like like their talk about the cytokines. I'm sure you have others, and you probably spoke about the like regulatory T cells and increase in Th17 cells, which are associated with autoimmunity. Um, and again, when you have that dysregulation and combined with not only that increased permeability, but exposure to those environmental toxins, to those infections, you get you want an abundance of those regulatory T cells. They help to suppress autoimmunity, to keep autoimmunity in check. And with this, all this does, this causes a decrease in those regulatory T cells. You get an increase in what's called Th17 cells, which help to promote autoimmunity. So again, it's kind of that balance that we spoke about before, trying to balance those cytokines. So with so Th17 isn't all bad. It's you don't want to just completely suppress Th17, but again, if it gets out of hand, that could be one of the mechanisms to help promote autoimmunity. And again, too little regulatory T cells, and some of the things I mentioned before, such as vitamin D, fish oils, even probiotics, curcumin have been shown to help increase regulatory T cells and while at the same time decreasing those Th17 cells.
Gotcha. So the immune system, so you'll have to correct me because I think that the way that I used to think about Graves was that the immune system somehow became, thyroid receptor antibodies and
Hmm.
starts stimulating the thyroid to produce more thyroid. Is that still accurate in terms of
Oh
the
yeah,
thing?
yeah. Yeah, I mentioned that earlier. Yeah, when talk
Yeah.
about the antibody. So yes, you're right. So as far as the actual immune, yeah. So as I mentioned earlier, when talk about the antibodies, you get with Graves, you get thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody. And so it's the actual antibody that stimulates those TSH receptors, which causes the excess production of thyroid hormone. So yeah. And also important to mention that a lot of people with Graves' disease have what's called thyroid eye disease. And with thyroid eye disease, you get those same antibodies, those same thyroid stimulating immunoglobulins that attack the tissues of the eyes, and that can cause swelling of the eyes. That can cause eye bulging. In some cases, it could cause double vision.
Yeah. Okay, great. So that was gonna be my next question is that so then you've got elevated levels of thyroid that's floating around in the body. And so what is that doing? What are the symptoms that are manifesting? So if somebody's listening to this right now and like what are this and they don't and they have Graves but they don't know it, or maybe it's like early signs for them, what could they possibly be experiencing from a symptom perspective?
Yeah, great question. So, one of the ways when I dealt with Graves, so I was losing a lot of weight. Now I was also dieting and detoxifying. I was overtraining. So, some of that was probably due to that as well. But the way I discovered that something was wrong is one day I was taking my resting heart rate and it was 90, which wasn't crazy high, but still it's higher than it should be. And then I checked it the next few days. It was anywhere between 90 and 110 beats per minute. And so I wasn't catching on with the weight loss because I thought that was related to everything I was doing. But besides the heart rate, I ended up losing 42 pounds, going down to 140 pounds, which, I wasn't trying to
Wow.
lose that much weight. Um, and so, yeah, weight loss is not, I can't say everybody experiences weight loss. Some people don't with Graves, but that's like more of a classic symptom, the resting heart rate increasing, heart palpitations, tremors, anxiety, insomnia, just increased bowel movements are common as well. So yeah, hair loss very common. I know with both hypo and hyper, but it seems to be worse in my hyper patients compared to those with hyperthyroidism and Hashimoto's. But yeah, those are some of the common symptoms. Again, especially like the what I find is the heart rate in most people elevated, palpitations quite common. Like I said, the weight loss, it really depends on the person. But the hair loss is very common as well. And then again, some of these other symptoms that increased appetite. I had a voracious appetite, which again, I thought it was more just to restricting my diet and when I was trying to lose weight. But again, everything speeds up. Like with hypothyroidism, it's the opposite. Like you get coldness, whereas like another symptom of hyperthyroidism, like heat intolerance. With hypothyroidism, you get weight gain compared to weight loss. You get brain fog instead of increased bowel movements. You tend to get constipation with that. So yeah, so with Graves, everything increases, and yeah, so it's. But again, sometimes it could be overlap of symptoms. Sometimes we mentioned people could have antibodies for both Graves and Hashimoto's. And again, not that they will necessarily fluctuate back and forth between hyper and hypo. Sometimes that could happen. But it's also worth mentioning there is what's called hashitoxicosis, which sometimes gets misdiagnosed as Graves, but it's actually Hashimoto's, that where the person experiences transient hyperthyroidism, and so they might kind of go back and forth between hyper and hypo and be like, "Hey, what's going on here?" And the doctor might say, "You have Graves," but they never tested the Graves antibodies. They just based it on the person being hyperthyroid, and maybe they did the Hashimoto's antibodies, but still a number I've seen over the years, some people get misdiagnosed as having Graves when they actually, when you dig deeper, they would have the negative TSI, the negative thyroid stimulating immunoglobulins, and it turns out that they had Hashitoxicosis.
Interesting. I never knew what that term was. I always thought um, that it was from destruction of the thyroid, a bunch of thyroid hormone was released, and they get these periods where they end up with lower thyroid. But in the meantime, that they end up, they have these moments of having higher thyroid. Is that not the mechanism of action?
Yeah, well, that is, yeah, like with Hashimoto's, that is like with Hashitoxicosis. I mean, again, I guess you could say even with like regular Hashimoto's, but with Hashitoxicosis, it does seem like it persists, like not as long as Graves, but you have like I said, it's not going back and forth, where like few like in the morning someone's hyper, the evening someone's hypo. Not to
Mhm.
say that doesn't happen, but yeah, you're absolutely right. Where you get the damage to the thyroid hormone, and then it floods into the bloodstream, and so the person experiences hyperthyroidism. But again, when you talk about that, you would think, well, that's probably what is that going to last, like a few minutes or an hour or two. But again, that could persist for days, many times weeks, sometimes even months.
So people who have hyperthyroidism or Graves, they can have fatigue as well, right? It's not just Hashimoto's or hypothyroidism.
Yeah, absolutely. I mean, I can't say across the board everybody experiences fatigue, and I'll be honest, like when I dealt with Graves, I can't say that I was fatigued, but it makes sense why fatigue would be common. I mean, one reason is that hyperthyroidism does put a lot of stress on the mitochondria, which are the energy powerhouses of the cell, as you know. So if you have stressed out mitochondria, mitochondrial dysfunction over time, that definitely can lead to fatigue, even in the presence of hyperthyroidism. And then adrenals. Adrenals also can cause fatigue. I mean, just widespread inflammation, like again, if someone has stealth infections, you're familiar when it comes to, of course, Lyme and Bartonella, being that you personally dealt with them, as did I. And I mean, so those can cause fatigue. So they could, but like I said, just alone, the impact that it has on the mitochondria can result in fatigue when dealing with Graves.
Yeah, it'll eventually get burned out, it sounds like.
Yeah, well, I mean, yeah, I wouldn't say burnt. You mean the thyroid or the mitochondria?
Mitochondria.
Oh, mitochondria, yeah, yeah. Because it's funny, some doctors will say eventually you'll burn, like the with Graves, they'll use the term burned out. Oh, your thyroid is probably going to burn out. And usually what happen with that, what they mean with that, or I don't know, sometimes what they mean. I actually have a podcast episode where I spoke about that. Usually what happens is, again, someone might have the antibodies for Graves and Hashimoto's, and over time, in the back, even though they're hyper at the moment, there's damage taking place to the thyroid in the background because they also have those Hashimoto's antibodies. So they might become hypo. And so a lot of doctors will tell their patients, yeah, your thyroid eventually may burn out. So when you said burnout, I thought you were talking about thyroid, but you're right. The mitochondria will, yeah, over time, if you're dealing with um, not just hyperthyroidism, but other conditions, definitely could put a lot of stress and cause a lot of dysfunction.
Yeah. Okay. So in terms of what is the conventional treatment for hyperthyroidism?
So there are essentially three main treatment options from a conventional standpoint. Number one is anti-thyroid medication. In the United States, methimazole is commonly recommended, and sometimes what's propylthiouracil, also known as PTU. And in other countries, it might be carbimazole, which converts to methimazole. And so really, it's blocking thyroid hormone production. And And again, it comes with a lot of side effects, but there is a time and place for it. I do have a good number of patients on the antithyroid medication, and just because it does work, and the other two options are less desirable. So number two is radioactive iodine, and that's when pretty much you're using radioactive iodine to ablate the thyroid to destroy the cells of the thyroid gland. And most of the time, the person will become hypothyroid and need thyroid hormone replacement. Every now and then, they won't use enough, and the person will need another round of radioactive iodine. Um, and then number three is a thyroidectomy, getting thyroid surgery. And again, there's a time and place for thyroid surgery, but the issue with thyroid surgery and radioactive iodine is, again, these are Graves is more of an autoimmune condition than a thyroid condition. So if you're just removing a thyroid or you're ablating the thyroid gland, you're not doing anything to improve the immune system health, or at least endocrinologists won't do that. They'll just recommend the treatment and again put the person on thyroid hormone replacements. Uh, so so yeah, those are the typical one of those three options usually will be given when you get diagnosed with Graves by going to an endocrinologist.
So they're addressing symptoms. They're trying to decrease the amount of thyroid that's floating around in the body, but they're not addressing the cause.
Exactly.
Yeah. Stopping that autoimmunity from happening, the stimulating effect of the immune system on the thyroid.
Yeah, well, exactly, which is important. I mean, you want to do that. And like I said, I'm not opposed to the medication, but I think it's extreme. Again, not said as not a time and place, like I said before, but a lot of endocrinologists, unfortunately, will jump right to the radioactive iodine thyroid surgery, whereas others will be more conservative and they'll put the person on antithyroid medication. And studies show, even though I'm not a big fan of antithyroid medication, there are some people that when they're on the antithyroid medication, they kind of get, I mean, I won't say remission because we're not addressing the cause of the problem, but some people will be able to stay on a low dose of antithyroid medication for many, many years. And this is according to the research. And I bring this up because many endocrinologists will say it's not safe to be on antithyroid medication for longer than 2 years, for example. And the research just doesn't support that. The research shows that, and again, this isn't my goal. My goal isn't to have someone stay on methimazole, for example, long term. But if it's a choice between staying on low dose antithyroid medication for 5, 10, 15 years or getting your thyroid removed or ablated, to me, I'd rather be on the medication, the lower dose of medication, as long as you're tolerating it. If you're having
Right.
elevated liver enzymes, depressed white blood cell count, or other symptoms, that's a different story. But if you're tolerating it, to me, there's no reason to jump into these other treatment options.
Yeah, I would consider that a band-aid. I always prefer natural band-aids, but it's kind of like, but oftentimes we need band-aids. If somebody's got anxiety or heart palpitations or chronic diarrhea from having Graves' disease, and you want to slow that down and you want to give them better
Yeah.
quality of life, like let's do that while you're dealing with the marathon of getting rid of what's causing the autoimmunity, because oftentimes that takes longer, correct?
Yeah. I mean, without question, a natural approach. There's no, I mean, there's no quick cure. Like again, they'll talk about radioactive iodine surgery being a cure, but again, you're not cure. As you said, it's more of a band-aid approach. The natural option, the goal is to address the underlying cause. But you're absolutely right. I mean, it takes time to do that, and there are just some people that choose the surgery or radioactive iodine because they look at it as a quick fix, and they don't want to take the natural approach. Or again, unfortunately, most endocrinologists aren't on board with the natural approach. So they might read one of my books, for example, and then bring it up to the endocrinologist, and the endocrinologist shoots it down, says, well, there's nothing that could help autoimmunity. It's uncurable. So diet's not going to help. Reducing your toxic burden is not going to help. So yeah, I mean, the only solution really is ultimately to remove your thyroid or to get the radioactive iodine. And unfortunately, a good number of people will take the advice of the endocrinologist without really opening up their mind and at least giving a natural approach a try.
Right. And then they find your book and then they're kicking themselves I mean, there's so many people that I've seen over the years who are like, gosh, I really wish I hadn't done that. And they're usually talking about, radioactive iodine or getting the thyroidectomy or something like that. So then
Yeah.
what's your approach then to address Graves holistically?
Yeah, great question. So I should, before talk about like the autoimmune component, I should mention that from a symptom management perspective, I was able to avoid the medication.
Mm.
Not everybody can, but there are certain herbs that could help potentially. So I took what's called bugleweed, which is not one of the more common herbs out there, but it has anti-thyroid properties, and motherwort, which is kind of like a natural beta blocker, obviously not exactly the same, and these are not as potent as a medication. And honestly, I had no idea whether or not they would work. I learned about them when I was taking continuing education credits as a chiropractor, and again, never knew that I would need to take them for for myself in the future. But thankfully, I did attend those seminars and learned about them, and I took both of those herbs when I was dealing with Graves, and they work great. And sometimes people will take them and they won't work. I'd say most of the time, like 70% of the time, which is pretty good, they will work. But some people, they won't be effective and they will need to take the antithyroid meds. But so there are natural options. L-carnitine also, which I'm sure you're pretty familiar with L-carnitine. So I mean, it has multiple benefits. Actually, mitochondria helps with fatty acid oxidation, but the research shows that in higher amounts, like 2 to 4,000 milligrams per day, it could actually block the entry of thyroid hormone into the cell. So that's another possibility when it comes to managing symptoms naturally of Graves. And and or even other hyperthyroid conditions. We're focused on Graves, but there are other like toxic multinodular goiter. So there are people I've had where they've taken like the bugleweed motherwort for that. Completely different because it's not autoimmune. But as far as talk about Graves and autoimmune component, I mean, really, it's just addressing those triggers. Just again, cleaning up the diet, eating an anti-inflammatory diet. I mean, definitely the toxic five that you talk about play a big role. Just besides the food, and you mentioned like the stress and the sleep, and the nervous system dysregulation, all that. Um, but yeah, I mean, without question, the heavy metals, the chemicals, the mold in many people, the infections. I mean, just we take a little bit. You and I take a little bit of a different approach. I do some functional medicine testing still. I know you just have people on the protocol just based on your experience, and I mean that's a great thing about functional medicine is that we all have different approaches and again, we all change. I think you used to do testing, and then you
Right.
just found out that hey, just I could just take this approach without doing the testing for my long haul COVID patients and all that. And who knows, maybe in the future, and again, I don't do a crazy amount of testing. That's one thing too. So I am more conservative when it comes to testing. Um, but yeah, I mean, it all comes down to addressing these imbalances, addressing these triggers, healing the gut, correcting any nutrient deficiencies.
So how long does it typically take for people to get better to reverse the condition?
Um, about 2 or 3 weeks usually. I'm just kidding, just kidding. No, it's yeah, it's yeah, I wish honestly. I mean, it does take it takes quite a while. I mean, in my situation, took about 9 months before everything was looking good on the blood test, including the antibodies, and I was off the bugleweed. But it's not uncommon for it to take longer. I mean, and it could take, well over a year. And again, even in my situation, when it looked good in not after 9 months, I didn't know if things were stable, like would I relapse? Because that was like the first time I was off the bugleweed. And so it took a few months really to know, okay, am I really, have I really restored my health? Am I really in remission? But yeah, I mean, everybody's different. I mean, in some cases, maybe it takes shorter, but I find I mean, anywhere between like 9 and 15 months. But again, some people could, as you know, I mean, autoimmunity is complex, just the body is complex. So, again, I know it's easy to get discouraged when someone's not seeing results quickly. And again, that's not to say it takes, 9 months or 12 months to start feeling better. But as far as really reversing the autoimmune component of Graves, it definitely can take time, and everybody's different. Some people will seem to progress smoothly without any setbacks, but I'd say on average, I mean, roadblocks are common. It's just definitely a healing journey, and everybody's different. But that being said, there is a reason, why you develop Graves. There's genetics is a factor, but it's not the most important factor. So even though it's going to take a while to restore one's health, to restore and reverse the autoimmune component, again, I definitely think it's worth it when you look at the potential consequences of getting radioactive iodine thyroid surgery. And again, there are definitely people, like you said, there are people who get radioactive iodine surgery and regret it. I mean, there are also people that get it and they don't regret it.
Right.
But you just don't know which category you're going to fall into. And once
Right.
you get it, you can't undo it. So if you get your thyroid removed and if they do any damage, or if you just have a hard time regulating the thyroid hormone, there's no turning back. And the same thing with radioactive iodine. So that's why I think it's worth taking a natural treatment approach, because most of the time it will work. It's just a matter of being dedicated and committed and realizing it will take time.
Yeah, and I appreciate your transparency. It's the same in my program. I tell people it takes at least 12 months to get better, if they have long COVID or chronic fatigue syndrome. So, and it just has to do with the amount of time it takes to get the toxins and the infections out of the body. And we
Yeah,
don't know how much each person has. So I appreciate that. And it's interesting because, whether we're dealing with long COVID, chronic fatigue syndrome, Graves' disease, or Hashimoto's, the reality is that there's autoimmunity, there's immune system dysfunction, and there's the toxic five that's in there, right? And so it has to come out. And so getting that mindset, where people have to understand that it's patience and persistence, that it's implementation is huge. We don't take anybody into our program anymore who can't demonstrate. When I'm on a free call with them, I ask them these questions, and they can, if they're not willing or able to implement, they're not going to be successful. And so we don't even let them into the program. It's that important. So I appreciate you saying that. And I also appreciate you talking about the roadblocks. I talk about
yeah,
them as bumps. Like there's always bumps along the way. There's going to be 30 or more different bumps over the next 12 months. And what you need is somebody like me or you in your back pocket for any sort of to navigate those bumps, right? Because
yeah,
I feel like that's,
exactly.
some of the most important work that we do is helping people navigate around those bumps. Because, I mean, how many times do people try to go with this alone? They try to take some of the herbs that you're talking about or whatever, and they hit a roadblock and they don't know how to get around it. You know what I mean? So
Agreed.
that's the benefit of having a guide who's done this before. So I appreciate that. And then you also talked about genetics versus the environment. So I'm curious about your take on this. I've done a deep dive into genetics years ago and just found that it was really all about. I remember there was a functional medicine conference, IFM conference on genetics. Maybe it was like 2010 or something like that. And I remember what I learned at that conference was that it was all about the environment. And so I'm curious, how much work on genetics do you do? Do you recommend any supplements for people's individual genetics, or are you mainly focused on the environment or a combination?
Yeah, first of all, I think I attended that same IFM conference well, on genetics, but yeah, and you're right. I mean, they pretty much say, I mean, because you can't change, you can change the expression of genes, but you're going to change that through the environment and diet and lifestyle factors. So, yeah, I don't really do genetic testing. I mean, especially I actually had someone recently I mean, there's different types of genetic testing. So there's testing to look at like genetic variations, like single nucleotide polymorphisms, and I usually I don't do those testings. I mean, I honestly have done it on myself years ago. When what 23andMe was not, it's different now, but I did a 23andMe and then imported it into like Genetic Genie and found out I had the C677T homozygous MTHFR. So, and again, I'm not saying there's no value in that. But I had a patient not too long ago do another type of genetic test looking at like HLA markers, just really seeing their susceptibility to different conditions. And then they wanted me to interpret it. I'm like, well, what is there to interpret? Like it's a susceptibility, like it's not really going to change my approach to what we do. I mean, I guess it's nice to know what you might be susceptible to, but just because you're susceptible to something doesn't mean that you're going to develop it. And what we're doing for one autoimmune conditions, Graves, is going to help you prevent other conditions from developing in the future.
Right.
So I'm not I mean, that type of genetic testing, I'm not a big fan of. I'd rather the person spend their money elsewhere. As far as like, again, the genetic testing, like just mentioned, looking at genetic variations, again, I'm not opposed to it. More so, I can't say I've never done the testing, but more times it's the patient that does it on their own, and then they might bring it to me. And again, I'm definitely not an expert when it comes to reading those tests. So there's some more of the more common ones I'm familiar with, but there are practitioners that's all they do to spend time just focusing on the genetic test, and it's probably better. They're probably better off having a consult with that person who, if they want to really know the ins and outs of
Right.
like all the genetic variations that they're dealing with. And again, you're always going to get fine. Everybody's going to have genetic variations. And like I said, it doesn't mean it's not sometimes going to play a role in detoxification, methylation. So I'm not saying it can't come in handy, but just I guess I've had good results without doing those tests on everybody. Would I get better results if I did the test on everybody? I don't know, maybe, but I'll throw that question at you. Do you do, my guess is no, since I don't think you do like functional medicine tests. So,
Right. Yeah, no
yeah,
more genetic testing. I went
yeah,
down that rabbit hole as well and studied some of Amy Yasko's work and got very
mhm,
familiar with the 23andMe and putting it into
yep,
Genetic Genie and doing all that
yep,
interpretation. And I just really didn't see it move the needle. And I found it
yeah.
to be an interesting intellectual activity, but practically, people are getting better so much faster when I was removing the environmental toxins and the infections. So,
Yeah,
yeah, we're definitely in the same vein there. Okay, great.
agree.
So we've got a couple minutes left. So we've gone through and we kind of talked about the progression of Graves, what sort of symptoms people would have, what treatment looks like. So I guess let's go a little bit into that. You talked about diet, you talked about supplements. What kind of what does the process look like? Does somebody are you introducing one supplement at a time? Are they capsules? Are they tinctures? Are there certain brands that you like? I mean, I don't need specifics on like what you're using, but I'm just curious about like what does that protocol look like? Do you end up, my protocol ends up with like 25 or 30 supplements that people have introduced all along the way to get rid of the toxic five. So I'm curious, what does your protocol look like for most people?
Yeah, I mean, as far as like whether they take tinctures or capsules or tablets, I mean, the herbs like the bugleweed and motherwort, for those who take that, it's in tincture form typically. And then everything else, it varies. There's some things I will recommend in tincture form. Others I will recommend capsules. I mean, compliance also is an issue too. So there are some people that just absolutely won't take the tinctures. Like my wife probably wouldn't take the tincture. She wouldn't force herself. Whereas with me, it's like, okay, it's just I could just down anything for the most part. But so we got to also take that into consideration. But otherwise, it will be like a variation of like some tinctures, some capsules, maybe some things with tablets. But mostly, I would say tinctures and capsules. And then um, as far as what like if they're taking everything at once or like one at a time, I mean, most people are taking the supplements, I would say not one at a time, unless if they are super, like if they have certain sensitivities. Like whenever I give recommendations, I leave it up to the person. And I mean, if the person, like if someone's dealing with like mast cell activation syndrome, then maybe it's best for them to do it one at a time. But the typical Graves patients, again, most of the time they could introduce multiple supplements at once. Um, and it doesn't mean that like if there's like five things going on where they'll necessarily will do all five things at once, we might prioritize certain things. So yeah, like if someone needs, like you gave an example, like 25 supplements, like I'm not going to like say all at once take like tw 25, but I wouldn't say like just do one bottle like for a few days or a few weeks and then introduce the next one, unless if someone is sensitive, or if they want, like again, when I give the written recommendations, I'll really give them the option. I actually mention that most people do fine taking the supplements, the recommendations at once, but some people are sensitive, or some people just aren't sure. And so if someone just doesn't have a lot of experience with supplements and they want to introduce them one at a time just to make sure they're tolerating it, that's perfectly fine. And and then brands, yeah, I mean, I definitely like certain brands just because, I mean, some brands are, I mean, they have a better some brands have a better reputation. Some brands are third party tested, so know what you're getting in the supplements. I mean, especially like I know like Consumer Labs has like done random testing of like probiotics, for example, and just found that a lot of probiotics don't have the potency or the strains that listed on the labels. And with fish oils, you want to be careful and make sure it has like a certificate of analysis. Or, I mean, I wouldn't go into like Costco or, like Walmart and just get like fish oils, like just whatever brand of fish oil. So
Right.
yeah, definitely. Yeah. So without naming specific brands, because I do like different brands and I can't say there's like one single, just like with you, I'm sure you use different brands too. But yeah, I mean, some things are more important than others. Like that, like again, if I recommend certain brands and a patient comes back and says, "Hey, I like these," and if they're knowledgeable and I think they're good brands, I'll be like, "Yeah, if it's comparable, I don't really care if they take exactly what I recommend, but I'm always going to give specific recommendations because you know how that goes. If I were just to say, get whatever licorice root, get licorice root, a probiotic, a fish oil, and whatever other, especially like the herbs, you got to be careful. But really, with other supplements too, they might just go randomly on Amazon and just not really pay attention to the quality, or again, go to Walmart or GNC and just get something that's not working. And when they're spending, I understand they're trying to save money, but they might end up spending more money if they're getting supplements that aren't working.
Right. So
Yeah.
when you're killing infections, and then we'll transition. When you're killing infections, um, do you ever get die off? And if you do, what is your favorite die off support?
Yeah, yeah, definitely. I think most practitioners who work with infections will get some die off in their patients. I mean, the basics, first of all, make sure the person is well hydrated, drinking plenty of water, movement, which I know, especially like in your patients, sometimes could be challenging, like in your clientele with dealing with fatigue and all that, but, just moving. But yeah, the as far as from a supplement perspective, giving supplements to help with detoxification, I mean, they could do things. I was gonna say lymphatics, but lymphatics you could do things without. Yeah, like it's not like you have to jump on a rebounder. You could do some dry brushing, and there are other things. Not sure if you're familiar with the flow vibe. Have you?
I haven't.
Uh, Kelly Kennedy. Have you familiar with Kelly Kennedy? She deals with lymphatics, so another way of supporting lymphatics. But NAC, like N-acetylcysteine binders sometimes, to help with the die off. I mean, sometimes things like milk thistle as well, but But yeah, so a combination of supplement, again, hydration, the basics, hydration, movement, some detox supplements, some binders.
Excellent. All right, great. So thank you so much for sharing your knowledge with us today, Eric. So, where is the best place for people to go and learn more about the wonderful work you're doing?
Yes, so thank you. So they could visit savemythyroid.com, and there you could find all my books, which lead to Amazon. So Amazon, I have three books, two on hyperthyroidism, one on Hashimoto's, and my podcast, again, savemythyroid.com and click on podcast, or you could just type in Save My Thyroid in your favorite podcast platform. And then I have a newsletter, Healthy Gut, Healthy Thyroid, which you could check out by visiting savemythyroid.com/newsletter.
Awesome. That's great. And then how are you working currently with people? Are you doing one-on-ones, groups? What does that look like?
Yeah, currently mostly one-on-ones. I mean, I've dabbled with some groups, and so when this comes out, you never know. But over the years, it's been mostly working one-on-one and pretty much now exclusively remotely.
Excellent. Well, thanks so much for sharing your knowledge with us, Eric. Hopefully, this has helped some people who maybe they didn't know they had hyperthyroidism. Maybe they're going to go get checked, and hopefully, they'll come ask you for help.
Well,
So.
thank you again. Thank you so much, Dr. Evan. It was great having this conversation.
So if you have chronic fatigue, whether it's from long COVID or chronic fatigue syndrome, go ahead and click the link below to watch my latest masterclass, where I go deep into our four-step process that has helped thousands of others resolve their symptoms naturally. After you watch that video, if you're interested in seeing if we're a good fit to work together, you can then get on a free call with me. All right, thanks so much. I'll see you over there. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening and have an amazing day.